Today's topic about tympanic membrane. Tympanic membrane is a semi-transparent. You can see this picture. It is not completely transparent. It is semi-transparent partition between the external auditory meatus and tympanic cavity, or you can say middle ear. It is an oval shape, about 10 mm tall, 9 mm wide, and 0.1 mm thick. So thickness is very less, 0.1 mm. It is placed at angulation of about 45 degree to the floor of external auditory canal. It consists of three layers. Outer cuticle layer, that is stratified squamous epithelium, developed from ectoderm. Middle fibrous layer, developed from mesoderm, and inner mucosal layer, that is developed from the endoderm. And inner mucosal layer is low columnar epithelial layer. The color of normal tympanic membrane is pearly gray or pearly white in color. So there are two parts of normal tympanic membrane, is pars tensa and pars flaccida. Pars tensa is larger part and its periphery thickened and form a cartilaginous ring. That cartilaginous ring is called annular tympanicum. That fits in the bony sulcus, that is called tympanic sulcus, which is formed by the tympanic bone mainly, and that is bony, and it's above deficient, and deficient part of this bony sulcus is called notch of Rabinus, which having the another part of tympanic membrane, that is pars flaccida. And this pars flaccida between the anterior and posterior malleolar ligament is also called Sharpnell's membrane, that is Sharpnell membrane, and it is small triangular in shape. This part, pars flaccida, is triangular shape and it is between the anterior and posterior malleolar fold. It is thin because it doesn't have any fibrous layer. So this part deficient of the fibrous layer of the tympanic membrane. The fibrous layer of pars tensa having three type of fibers. The most lateral fiber toward the external auditory canal are radial fibers, which radiate from the umbo toward the periphery. So in this fibrous layer, most lateral fibers are radial fibers. Another fiber just inside to the radial fibers is circular fiber of fibrous layer. In between intermingled fibers are parabolic fibers. So these fibers are made up of collagen bundles. So outermost fiber in fibrous layer is radial fiber, then circular fiber, then in between intermingled fiber are parabolic fibers. So there are three types of fiber in middle layer, fibrous layer of tympanic membrane. You can see in this picture the layer of outer layer, that is cuticular layer, then followed by fibrous layer, and inner mucosal layer is low columnar epithelium in the section or histology of this tympanic membrane. So tympanic membrane having two surfaces, lateral surface and medial surface. As you can see in this picture, the lateral surface is concave towards external auditory meatus. It divided into four quadrants by the two imaginary lines. First imaginary line passing through handle of malleus and another line passing through the tip of the handle of malleus, or you can say umbo, at the right angle to the perpendicular line of handle of malleus. So there are four quadrants. Anterior inferior quadrant, you can see cone of light is there. Antero superior quadrant, posterior superior quadrant, and posterior inferior quadrant. So cholesteatoma is most commonly occurred because of retraction in the posterior superior quadrant. The medial surface of tympanic membrane is convex and maximum point of convexity is called umbo. Umbo is the attachment of handle of malleus on the tip of tympanic membrane where maximum convexity is towards the middle ear cavity. You can say tympanic membrane. The coda tympani, you can see in this picture, is closely related to upper part of tympanic membrane, that is pars flaccida. Nerve runs from posterior to anterior aspect, medial to the neck of the malleus, close to the tympanic membrane. The relationship of tympanic membrane. Laterally, it is external auditory canal. Medially, there is tympanic cavity. Superiorly, you can see there is middle cranial fossa. Inferiorly, being jugular valve. And anteriorly, you can see there will be TM joint. And posteriorly, there are mustard cavity. So these are the relationship of the tympanic membrane. The nerve supply of tympanic membrane. Lateral surface supplied by two nerves. Anterior part is supplied by the auriculotemporal nerve, and posterior half of lateral surface supplied by vagus nerve, that is Arnold's nerve, and medial complete surface of medial is supplied by the Jacobson's nerve, that is a branch of the glossopharyngeal nerve. Now blood supply of tympanic membrane. There are three artery supply. You can see first is anterior tympanic artery going through petrotympanic fissure, and deep auricular artery going through scomotympanic fissure into the middle ear cavity and supplying the tympanic membrane. They are both artery. This anterior tympanic and deep auricular are branch of first segment of internal maxillary artery. Another artery which is supplying below is the stylomastoid artery, is branch of the posterior auricular artery. So overall tympanic membrane supply by the mainly external carotid system, and venous drainage mainly in the external jugular vein laterally, and medially there is auditory plexus which is going into sigmoid sinus and transverse sinus.